What is the long-term prognosis for GIST stomach cancer? What can we expect in terms of long-term prognosis for gastrointestinal stromal tumors, often referred to as GIST, in the stomach? The prognosis for GIST can vary quite a bit based on several important factors. These include the size of the tumor, how fast the tumor cells are dividing, and whether the tumor is benign or malignant. Generally, the 5-year survival rate for stomach GISTs can range from about 55% to 70%. Smaller and less aggressive tumors tend to have better outcomes. Let's break this down further. First, tumor size plays a crucial role. Patients with tumors smaller than 5 centimeters often have much better survival rates. For instance, the 5-year survival rate for these smaller tumors is around 58%. In contrast, for larger tumors, the rate drops to about 38%. Next, we have the malignancy and mitosis rate. Tumors that show a high mitotic count, which means they are dividing rapidly, are classified as malignant. Unfortunately, these malignant GISTs have worse outcomes, with a 5-year survival rate of approximately 28% to 35%. On the other hand, benign GISTs can boast a much higher survival rate of about 70%. The stage of the tumor at diagnosis and the treatment received also significantly influence prognosis. Early stage GISTs that are treated with surgery and appropriate systemic therapy, such as targeted drugs like Imatinib, show improved survival rates. Even for patients with advanced stage for GISTs, survival rates can be notable. About 51% of these patients can still be alive 5 years after diagnosis if they receive the right treatment. Lastly, it's worth mentioning that patients who have other malignancies alongside GIST may experience different survival outcomes. However, the specific mortality related to GIST can be lower in these cases. In summary, the long-term outlook for stomach GIST largely depends on the characteristics of the tumor and the treatment approach. Smaller and less aggressive tumors can lead to a favorable prognosis, with survival rates potentially exceeding 70%. Meanwhile, larger or malignant tumors present a more guarded prognosis. Advances in targeted therapies have made a positive impact on survival, even for those with advanced cases. It is essential for patients to work closely with oncology specialists to develop a personalized treatment plan that optimizes their outcomes.